Okay, welcome back. See, the winter is past, the rains are over and gone. Flowers appear on the earth, the season of singing has come. The cooling of doves is heard in our land. Song of Songs, 211, 12. Okay, so now we're gonna go continue my UWorld journal. And let's see. Bulimia is increased salivary amylase, hypokalemia, hypochloremia, metabolic alkalosis. Bulimics are usually normal weight to overweight and tachycardic and have irregular menses. So basically bulimia, people have increased salivary amylase, hypokalemia, hypochloremia, metabolic alkalosis. Bulimics are usually normal weight to overweight and tachycardic and have irregular menses. Hypothyroidism is characterized by weakness, fatigue, cold intolerance, constipation, weight changes, menorrhagia, dry skin, and bradycardia. Primary hyperparathyroidism, you see hypercalcemia. Hypercalcemia causes mental changes, urinary stones, abdominal pain, and constipation. Okay, so hypothyroidism is characterized by weakness, fatigue, cold intolerance, constipation, weight changes, menorrhagia, dry skin. Hypothyroidism, if that's hypo, H-Y, hypo, where is it? Hypothyroidism. I show the chart. Right here, hypothyroidism. You have cold intolerance, decreased sweating, weight gain, decreased basal metabolic rate, decreased calorie genesis, hyponatremia, decreased water, uh, decreased free water clearance. So basically, the hypothyroid patient, they'll be overweight. Yeah, weakness, fatigue, cold intolerance, constipation, weight changes, menorrhagia. Menorrhagia is excessive periods. Menorrhagia. Yeah, yeah, heavy periods. Um, and bradycardia. And then primary hyperparathyroidism is when you see hypercalcemia. Hypercalcemia causes mental changes, urinary stones, abdominal pain, and constipation. So we'll get into that later, but just remember there's primary, there's secondary, so primary hyperthyroidism, secondary hyperthyroidism. Okay, so primary hyperthyroidism, you have so much calcium, and this causes mental changes, urinary stones, abdominal pain, and constipation. Okay. Okay, so when parents are overly critical, ask to speak to the child alone to get proper history and to ask about drugs, alcohol, tobacco, and sex. First, address mom's concern and ask her to wait outside while you talk to the boy or girl patient alone. Because the kid won't open up in front of the parents yet. Okay. All right. Second. Thanks. Yeah. That's easy. Okay, next, physicians should maintain a general policy of not accepting gifts of significant monetary value, even if the patient got them for free um, from their patients or their families. Okay, one-time gifts like a lower monetary value, like cards, photos, cookies are okay. I think that generally anything over $10 is a no. So yeah, absolutely accept cards, photos, cookies. Otherwise, it's you're messing with the doctor patient relationship. Yeah. Okay. All right. So next, 42. Patients have the right to refuse medical info. Yeah, patients have the right to refuse medical info about their condition, terminal or not. The only exception is when a diagnosis puts others at risk, like a transmissible infections. You have to tell the patient and whoever is like involved. Okay, patients have the right to refuse medical info about the condition, terminal or not. So if a patient has terminal cancer, they don't want to know how long they have or what kind of cancer, what stage. They tell you, you are not supposed to tell them. However, try to find out why they feel this way. Okay, 43. HIPAA protects health for info by inquiring verbal or written authorization of release of info. Family members who contact the doctor's office for info about their relatives should not be given any information about the patient without the patient's consent. HIPAA does not require proof of identity to respond, but even if family members call, you have no right to tell them. Okay. Medicare is an insurance program that causes individuals age 65 and older to have a work to have a okay, yeah, Medicare is an insurance program that covers individuals age 65 and older. Yeah, Medicare is an insurance program that covers individuals age 65 and older who have a work history. So Medicare is an insurance plan that covers individuals with age 65 and older who have a work history, those who have worked and paid taxes. They must hold residence and citizenship in the U.S. Medicare also covers younger individuals with disabilities like cerebral palsy, ESRD, or ALS. Medicaid is the insurance program for the homeless, undocumented immigrants, pregnant women, and low-income families. Okay. Okay. Next, minors under 18 usually require parental consent for non-emergency medical treatment, but minors can (CAN) consent to prenatal care, diagnosis, and treatment of STDs, contraception, and drug alcohol rehabilitation without their parents' consent, um, or the minor must be emancipated. What makes a minor emancipated is being homeless, a parent, married, financially independent, a high school graduate, or being in the military. Every emergency cases also don't need uh, emergency cases also don't need high school graduate or being in the military. Yeah, emergency cases also don't need high school graduate or being in the military. Emergency cases also don't need high school graduate or being in the military. Oh, sorry. Um, Emergency cases also don't need parental consent. All other cases require parental consent, like abortion. Okay. Now 46. SPIKES. This is a protocol for delivering bad news. S stands for set the stage. P stands for perception. Use open-ended questions to assess patient's understanding of medical situation. I is for invitation. Ask patient how much info they would like to know. K is for knowledge. Patient. Warm. Warn patient bad news is coming. Speak in simple terms. Stop and check for understanding. E is for empathy. Express understanding and give support when responding to emotions. S, summarize. Summarize and create follow through. Follow Summarize. Yeah. So S is for summarize. Summarize and create follow through plan, including end of life discussion, abnormal pregnancy, and terminal illness. So S stands for summarize and strategy. Summarize and create follow-through plan, including end-of-life discussions, abnormal pregnancies, um, terminal illness. 47. Tremulness. So tremors is usually the first symptom of alcohol withdrawal. Um, so there's a chart you have to know. Okay, mild alcohol withdrawal results in anxiety, tremors, insomnia, diaphoresis, palpitations, GI upset, respiratory rate goes up, heart rate goes up, temperature goes up. The orientation is usually intact, and this happens within 6 to 24 hours. Okay, so you see GI issues like nausea, vomiting, um, increased temperature, sweating, tremors. So this is the first sign of alcohol withdrawal, 6 to 24 hours. Next is seizures. Seizures presents 12 to 48 hours. Presents within 12 to 48 hours. Okay, seizures presents in 12 to 48 hours. You see single or multiple generalized tonic-clonic seizures. Okay, alcoholic. And then and the next one is 12 to 48 hours. Also, you see alcoholic hallucinosis. So this is visual, auditory, or tactile hallucinations, stable vitals, and orientation is usually intact. So basically, they have visual and auditory and tactile hallucinations. So 2 days they don't have alcohol. This is what they see. Is what you see in the patient. They start hallucinating. Okay. And they can also get seizures within 12 to 48 hours. Now, delirium tremens is it happens 48 to 96 hours without alcohol. Um, you have confusion, agitation, fever, tachycardia, hypertension, and diaphoresis. Okay, so delirium tremens. tremens. It can be fatal, yeah. So, yeah. So you have confusion, agitation, fever, tachycardia, hypertension, and diaphoresis, and that happens 48 to 96 hours later. Okay, 48 to 96 hours later means that means 2 to 4 days later it can happen from alcohol withdrawal. Okay? 2 to 4 days. 24, 2 to 4 days later. Okay, next. Okay, guys, we're going to make it to. Okay, this is a lofty goal. We're going to make it to 150 questions today, okay? Okay, we're on 48 now. We're gonna go hopefully cover. Okay, so I mean, let's see. Okay, so um, acutely alcohol use. Acutely alcohol use increase the effects of GABA at the GABA A receptors in the CNS, leading to sedation. Okay, acutely alcohol use increases effects of GABA at the GABA A receptors in the CNS, leading to sedation. Chronic alcohol use uh, leads to destruction of GABA receptors, or it leads to destruction of GABA receptors and decreased sensitivity of GABA receptors. Alcohol also inhibits excitatory NMD receptors in the brain, so alcohol causes body to become slower over time because you're stopping an exciting thing. Chronic exposure to alcohol leads to upregulation, so that's increased sensitivity to receptors of NMDA receptors in the brain. So more NMDA receptors happen, and then alcohol causes them to become inhibited. So body becomes more slower over time. Both downregulation and upregulation of alcohol causes the body to get let's see. So Some more NMDA receptors happen and the alcohol causes them to become inhibited. So the body becomes more slower over time. Both downregulation and upregulation of alcohol cause the body to get more slower. Withdrawal symptoms occur within 5 to 10 hours after the patient's last drink. Peak symptoms of withdrawal happen in 2 to 3 days and subside in 4 to 5 days. So the peak of withdrawal happens in 2 to 3 days, so which is 48 to 72 hours. And then after that you see delirium tremens, and then it will start to subside. The symptoms will subside. So what you have to know: alcohol increase effects of GABA, and this leads to sedation. Chronic alcohol use leads to decreased sensitivity of GABA receptors. Alcohol inhibits excitatory NMDA receptors in the brain. Okay, alcohol inhibits excitatory NMDA receptors in the brain. So alcohol causes body to become slower over time. Okay, so alcohol causes the body to become slower over time because you're stopping an excitatory thing. Stops NMDA. Okay. Chronic exposure of alcohol leads to upregulation. Chronic exposure of alcohol leads to upregulation, increased sensitivity to receptors of NMDA receptors in the brain. Okay, guys, so I'm just going to recap what I just said about alcohol. Alcohol causes increased effects of GABA at the GABA A receptors, leading to sedation. So GABA is inhibitory, right? So when you drink alcohol, it increases the effects of GABA. It increases the effects of GABA. Which is why people are disinhibited. They get slower, right? GABA is inhibitory, so when you increase the effect of inhibitory, you become slower, right? This is why they fall asleep. Sedation. So when you see somebody drunk, just know that their GABA is acting up. Okay, and now if it's a chronic alcohol use, it leads to destruction of the GABA receptors, right? Because the GABA receptors stop becoming sensitive to alcohol, and then alcohol also inhibits NMDA receptors in the brain, which are the excitatory receptors of the brain. So it inhibits that, so the body becomes slow over time. Right? That's why chronic alcoholics, they're like disinhibited. They're slower. They have memory lapses. Yeah, because their GABA receptors and NMDA receptors are being destroyed. Okay, So chronic exposure, alcohol leads to upregulation of NMDA receptors in the brain. So when you don't have, because the NMDA receptors are being inhibited with alcohol, um, your body makes more NMDA receptors. So that's what they're saying when about chronic exposure of alcohol leads to upregulation of NMDA receptors in the brain. So that means more receptors, more sensitivity to NMDA to alcohol by NMDA receptors. Mm. So more NMDA receptors happen, and the alcohol causes them to become inhibited. So the body becomes slower over time, and then both downregulation and upregulation of alcohol causes the body to get more slower. Withdrawal symptoms occur within 5 to 10 hours after the patient's last drink. Peak symptoms of withdrawal happen in 2 to 3 days and subside in 4 to 5 days. Okay, so now you know GABA is alcohol increases GABA. Chronic exposure to alcohol also increases the NMDA receptors in the brain. Okay, next, 49, schizoid and schizotypal um, disorders both have social avoidance, find discomfort in close relationships, they're content with their social isolation. Okay, schizoid and schizotypal both love their alone time, and they get uneasy in close interpersonal relationships. Okay, now 50. Somatic disorder. Somatic symptom disorder is what is that? Somatic symptom disorder. Okay, so somatic. So this is somatic symptom disorder. When you have more than one bodily complaints, abdominal pain, fatigue, lasting months to years, associated with excessive persistent thoughts about anxiety and anxiety about symptoms, may co-occur with medical illness. Treatment is regular office visits with the same physician in combination with psychotherapy. Okay. When you have complaints like abdominal pain, fatigue, lasting months to years, associated with excessive, persistent thoughts and anxiety about the symptoms. Okay, may co-occur with medical illness. So, think about somatic symptoms is that the symptoms are unconscious, the motivation is unconscious. Category disorders characterized by physical symptoms causing significant distress and impairment, symptoms not intentionally produced or feigned. Okay, so these people, they truly really believe they have cancer. Okay, they believe they have cancer or some kind of terminal illness, and that they keep asking to check and to double check. Otherwise, they have this intense fear that they have a disease and they're going to die. So it's more equal to one or more than one complaint, and um, the treatment is with the treatment is scheduling regular visits with the same provider, which is usually the PCP. Don't do any unnecessary workup, specialist referrals. Reassure serious illness has been ruled out. Psychiatric health referral is only recommended once a patient-physician relationship is well established. Okay. Treatment should be expressing patient concern and stress reduction, diet, exercise, return to productive activities. 50. PCP is an NMDA receptor antagonist. Okay, NMDA receptor antagonist. It causes ataxia, horizontal and vertical nystagmus, and delirium can also present. Okay, so PCP, NMDA. NMDA is what? It's the excitatory, um, excitatory. Okay. Where is it? PCP is an NMDA receptor antagonist. PCP is an NMDA receptor antagonist. Ataxia, horizontal and vertical nystagmus, and delirium can also present. As an NMDA receptor antagonist, ataxia, horizontal and vertical nystagmus, and delirium can also present. 51 is clozapine is reserved for treatment-resistant schizophrenia. Clozapine is reserved for treatment-resistant schizophrenia. Clozapine is reserved for treatment-resistant schizophrenia. And schizophrenia associated with suicide. Treatment requires monitoring of the absolute neutrophil count due to the risk of agranulocytosis. So side effect of clozapine is agranulocytosis. Adverse risks include agranulocytosis, seizures, myocarditis, and metabolic syndrome. Okay. Clozapine. I think clozapine is a first generation drug. Let me just look. Clozapine. Okay, no, clozapine is second generation. Typical antipsychotics. This is first generation antipsychotics, which have greater side effects. Okay, haloperidol, fluphenazine, chlorpromazine. Atypical is the second generation. These ones are clozapine, olanzapine, quetiapine. They have less side effects than the first generation. Okay. Clozapine is reserved for treatment-resistant schizophrenia. Okay, next. Oppositional defined disorder is argumentative and defiant behavior toward authority figures like teachers and other students. but not cruelty towards law enforcement, animals, stealing, deceit as seen in conduct disorder, oppositional defiant disorder, um, can precede the development of conduct disorder and increases the risk of antisocial personality disorder, impulse control problems, substance use, anxiety, and depression. It has to be equal or more. It has to be equal to or more than 6 months. 52. Root cause analysis is a quality improvement measure. Root cause analysis is a quality improvement measure that identifies what and how and why a preventable adverse outcome occurred. Why a preventable adverse outcome occurred. Root cause analysis is a quality improvement measure that identifies what and how and why a preventable adverse outcome occurred. The first step is to collect data by interviewing all involved parties. Okay, manic episode, more than 1 week or equal to 1 week of elevated mood with increased energy and increased hyperactivity, or irritable mood and increased energy, hyperactivity would need to be seen. Okay, so manic episode is more than 1 week or equal to 1 week of elevated mood with increased energy or increased hyperactivity, or irritable mood with increased energy. Hyperactive would need to be seen. Okay, minimum of 3 symptoms of dig fast would need to be noted if mood is just persistently elevated with increased energy, hyperactivity. Okay, so basically if somebody, you're trying to assess for mania, you need a minimum of 3 symptoms of dig fast, right? Dig fast. You need a minimum of 3 symptoms of dig fast would need to be noted if the mood is just persistently elevated with increased energy and hyperactivity. So here's a thing for dig fast. Distractibility, impulsivity, grandiosity, flight of ideas, activity increase, sleep deficit, talkativeness. So somebody's having a manic episode. Basically, they would need 3 symptoms out of these. 3 out of the 7 symptoms would need to be noted. If mood is just elevated, if the mood is just, so basically if they're just hyperactive, you would need three of these symptoms from dig fast to call it manic episode. Okay, and you need 4 symptoms of dig fast if the mood is just angry, like irritated mood. So you need 3 symptoms when the mood is persistently elevated, and so you need 3 symptoms when the mood is persistently elevated, and 4 symptoms of dig fast if mood is irritable. And this has to go on for a week. Okay. So it's distractibility, I is for impulsivity or indiscretion, which is risky behavior like spending, making huge investments, increased sex drive with strangers. G is for grandiosity, which is inflated self-esteem. F is for flight of ideas. A is for activity, like increased activity. Increase in goal-directed activity. Psychomotor agitation, like they're fidgety, they're running around. That kind of thing. And then sleep, they don't need any sleep, so they're functioning on very little sleep. T, talkativeness. Pressured speech is like anyway, pressured speech is like, how do I explain it? Pressured speech, I've seen it when I was in hospital. But pressured speech, this is Someone speaks faster than usual with irregularities, rhythm and loudness with a sense of urgency. Rapid speech without pause. Okay, that's how I can explain it. Okay, let's see. And then next, the same one. In bipolar type 1 with psychotic features, hallucinations, auditory mainly, and delusions may be present. These delusions in bipolar type 1 with psychotic features are usually grandiose delusions where the patient believes they have special powers and talents, like healing people. Okay, so that is a bipolar 1 with psychotic features. It's auditory hallucinations mainly. Okay. Okay, 54. Schizotypal disorder is eccentric, odd thoughts, perceptions, and behavior. There is still social anxiety despite familiarity. They rarely sustain close interpersonal relationships due to excessive social anxiety, which does not diminish with familiarity. Yeah, schizotypal people, they believe they can control the weather. If they wear a bright yellow shirt, they believe it will be sunny today. They, even if they have friends or people that they know, they still don't get okay with close relationships. 55. Most common side effect of SSRI is sexual dysfunction. Most common side effect of SSRI is sexual dysfunction. So SSRI is caused decreased libido, decreased arousal, anorgasmia in women, and increased ejaculation latency in men. Okay, what is that? What is ejaculation latency? Ejaculation latency is the time between the start of sexual activity and ejaculation. So SSRI causes increased time between when someone starts to have sex and during the time they ejaculate. So it causes longer. It takes longer for them to have ejaculate. Okay, so it takes longer for men to ejaculate with SSRIs. Okay. Alright, 56. Learning disorder are characterized by difficulties with key academic skills, reading, writing, or math, resulting in performance well below expectations. For age level, learning disorder occurs when the child is deficient in a particular area, like math, reading, writing, but not all three. Like it's a specific learning disability. That would be a learning disability. Learning disability begins in early development and includes deficits in general mental abilities and adaptive functioning. Okay. 57. A benzodiazepine can be given along with an SSRI if panic attacks are very bad. Like if the panic attacks cause insomnia. Yeah, so you can give, if there's a panic attack that causes insomnia, you can give benzodiazepine along with SSRI. Triazolam is a benzodiazepine that can be used for insomnia in people with critical care jobs like 911 operators. Okay. Like 911 operators. Triazolam is a benzodiazepine that can be used for insomnia in people with critical care jobs. Okay. Its short life is critical for people like operators because it minimizes daytime sleepiness. Okay, so triazolam has a short half-life. Okay, so that means it leaves the body quickly. People with critical care, so it's good for people in critical care jobs like 911 operators, people who operate large trucks. Um, yeah, short life is critical for people like operators because it minimizes daytime sleepiness. Um, best for triazolam or alprazolam, also short life drug. Okay, to be used before bedtime. So yeah, alprazolam. You have triazolam and then alprazolam. 58 is. Okay. 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 Well, let's see. 58 patients with previous attempts are 5 to 6 times more likely to make another suicide attempt. Elderly white men over 75 have the highest suicide risk. Remember that. Patients, the greatest respect for somebody who've had, the greatest respect for someone who previously tried to commit suicide. Oh, sorry. The greatest respect to know if someone's going to commit suicide is a previous attempt. Okay? Alright. Patients with previous attempts are 5 to 6 times more likely to make another suicide attempt. Elderly white men over 75 have the highest suicide risk. Depersonalization or derealization disorder is a dissociative disorder involving recurrent episodes of feeling detached from one's own body and or feelings of unreality. Yeah, derealization disorder is a dissociative disorder involving recurrent episodes of feeling detached from one's own body and or feelings of unreality. So basically, they'll feel like a ghost floating up outside somewhere. Um, okay, that's what they feel like. This is a depersonalization, derealization. Okay. All right. 60. Psychotic symptoms only show up during a major depressive or manic episode in bipolar disorder or major depressive disorder with psychotic features. So, guys, remember this. There's something known as major depression, major depressive major de- MDD with psychotic features, major depressive disorder with psychotic features, and there is also bipolar type 1 with psychotic features. How you differentiate this is these psychotic symptoms, okay? Psychotic symptoms like hallucinations, yeah, hallucination, mainly auditory, only show up, like they only show up during the mood episode. Okay, so psychotic symptoms only show up during a major depressive or manic episode. So somebody with bipolar one, uh, with bipolar one with the psychotic features, while they're having their manic episode over that 7 days, they also will have hallucinations, and that's the only time they'll have hallucinations, which is a psychotic symptom. So yeah, psychotic symptoms only show up during a major depressive or manic episode, and both a bipolar disorder or major depressive disorder with psychotic features. 61. Diagnosis of schizophrenia. You need two of the following five. Okay, for diagnosis of schizophrenia, you need two of the following five symptoms. Number one, delusions. Number two, hallucinations. Three, disorganized speech. Number four, grossly disorganized. Yeah, number four is grossly disorganized behavior. Number five is negative symptoms. One of these must be delusions, hallucinations, or disorganized speech. Okay? Alright, so what was that? For diagnosis of schizophrenia, you need two of the following five symptoms. Okay, the five symptoms are delusions, hallucinations, disorganized speech, grossly disorganized behavior, and five negative symptoms. Now, out of these, one of them must be delusions, hallucinations, or disorganized speech. Okay? Alright, delusions. Hopefully everyone knows the difference between delusions and hallucinations. So, delusions is a fixed false belief. Okay? It's like you believe that aliens implanted a chip in your brain, and and they're controlling you, and then you are coming to the doctor to telling them, please take it out. That is a delusion. Whereas if they said, I saw the alien come and implant chips in other people's brain, and now they're gonna come get me too, that's a hallucination. Okay? All right. Now, number three, disorganized speech is like they'll be talking. These patients, schizophrenic patients, they'll be talking. They have no absolute zero correlation between sentences. Okay, that's like there's a word for it. We learned this in psych rotation. I believe it's called tangentiality. Yeah, it's like let me look it up. Tangentiality. Tangentiality. Yeah, it's like yeah, see this? A thought process, a thought disturbance that is marked by oblique speech in which a person constantly digresses into irrelevant topics and fails to arrive at the main point. So yeah, this is a disorganized speech, okay? So that's what that is. Okay. So you need delusions, hallucinations, or disorganized speech to one of the out of the two symptoms. One of them must be these three, and then 4 and 5 negative symptoms and disorganized behavior. Okay. All right. So disorganized behavior is something like completely out of the ordinary, like if they are using the litter box to pee in, or they're just not showering at all. Um, it's not, completely abnormal things that that we know that they're not well. So that's disorganized behavior. Negative symptoms. Okay, what are negative symptoms? Negative symptoms are like how we describe this is like deviation from normal things, like a normal, uh, like somebody without schizophrenia, they'll be smiling, they'll have a range of emotions on their face, um, but for schizophrenia, you'll have very limited range of emotions on their face. um, they're not smiling. um, it's like negative sense of you uh, what you take away from a normal uh, person. Anhedonia, yeah. So loss of interest to do enjoyable things. A volition, a lack of energy and initiative. Social withdrawal. Um, Alogia, negative cognitive disorder, in which a narrowing of speech and poverty, content of speech. So it's like taking away what is deemed normal in a normal person. Okay. Okay. Next. Okay. And schizophrenia. All these must be present for at least 6 months. Um, yeah. All this must be present for at least 6 months or more. 62 factors associated with better treatment. Factors associated with better treatment adherence for adolescents include close peers with complementary behavioral practices. Factors associated with better treatment adherence for adolescents include close peers with complementary behavioral practices. For example, insulin adherence. Okay, so for children, for children and teenagers, if you want them to have be better at taking their medication, for maybe somebody like a diabetic, a child that has type 1 diabetes, the best thing you can do for them, close peers with complementary behavior practice. So kids that are doing the same thing, that is, they're more suited, or they'll take their medication better, like they'll be more compliant to medication that's in that environment. Well, close peers with complementary behavior practices. Okay. 63. In intimate partner violence, the first thing you want to do is make sure they have a place to go in the time of emergency. Yeah, that's the first thing you want to make sure they can be somewhere safe. In intimate partner violence, the first thing you want to do is make sure they have a place to go in the time of emergency. 64. Buspirone is a non-benzodiazepine anxiolytic used to treat GAD. Buspirone. It's a non-benzodiazepine anxiolytic, relieves anxiety, used to treat generalized anxiety disorder. Okay. It has slow onset of action, lacks muscle relaxant or anticonvulsant properties, and carries no risk of dependence. Buspirone is typically delayed up to 2 weeks, and it's not used in acute anxiety. Okay, so this is like for management of GAD. In generalized anxiety disorder, acute GAD, what do you give? I think generalized. I think. Generalized. Yeah. So for adults, it's more than for adults, it's more than these three: restlessness, irritability, sleep disturbance, fatigue, muscle tension, difficulty concentrating. For children, it's just more than one of these. Treatment is CBT, which is cognitive behavioral therapy, SSRIs, and SNRIs are first line. Buspirone and TCAs are second line, and benzodiazepines are second line. Okay, so yeah, benzodiazepines you don't give for anxiety. You don't give for acute anxiety. Um, okay. So for SSRIs, you get acute. Well, SSRIs take long too. Uh, maybe that would be maybe that would be somewhat skip for treatment for acute anxiety. Okay, so you give benzodiazepine for acute attack. Okay. So buspirone, it's a non-benzodiazepine used for long-term management of GAD. It carries no risk of a dependence. Works 2 weeks later, so you don't give an acute anxiety. 65 conduct disorder is a pattern of violating major social norms and rights of others for over 1 year. Okay, that is what is seen in kids before they can be diagnosed with antisocial personality disorder. So this is conduct disorder. Okay, um, I think even there were signs of Ted Bundy um, as a kid, like Ted Bundy, Ted Bundy as a child. Yeah. So on at least one occasion, his aunt woke up to find her toddler nephew, Bundy, placing knives under her sleeping form. She later told Vanity Fair, "I remember thinking at the time that I was the only one who thought it was strange. No one did anything." Okay. So yeah, he's Ted Bundy has been planning out a lot of things since as a kid. As a child, um, there were signs. There's always signs that he was mentally unwell. As a kid, he yep break the law. Look at this. Violent tendencies, we had to break the law. So this is conduct disorders, exactly conduct disorders. So a fellow Boy Scout member, Bundy, once came from behind him to hit him over the head with a stick. Um, Bundy liked to save people. She recounted his fondness for digging holes in the ground, putting stakes inside, then covering them with vegetation. And once a girl fell on her legs, and one of these were in one of these tiger traps. He's violent to animals. Yeah, so this is exactly what conduct disorder is. And of course, Ted Bundy had an ASPD, which is antisocial personality disorder, and conduct disorder uh, is something that needs to be seen in as a kid before you get diagnosed with antisocial personality disorder at age 18. Okay, so that is just an example of how Bundy had conduct disorder as a kid. All right. Yeah, conduct disorder, pattern of violating major social norms and rights of others for over a year. 66, methylamphetamine causes a decreased appetite, weight loss, and insomnia. It has a rapid onset of action. Otherwise, other adverse effects of this drug include tics, um, increases in heart rate and blood pressure. Okay, panic disorder. You give SSRI. Immediate treatment for panic disorder is benzodiazepine, unless patient has past history of substance abuse, in which case you give the SSRIs due to low dependence and low side effects. While benzodiazepines have a much more rapid onset of action, benzodiazepines carry risk for abuse and increased dependence and withdrawal if stopped suddenly. Yeah. So somebody history of has a history of substance abuse and they're having a panic attack. Do not give them benzodiazepines. Give them SSRIs. Okay. Okay. Then the 68 hypocretin and hypocretin 2 are neuropeptides. Are neuropeptides produced in the lateral hypothalamus that function to promote wakefulness, and they also stop REM sleep related phenomena. Most patients who have narcolepsy with cataplexy demonstrate undetectable levels of hypocretin in their CSF. This is why they fall asleep during the day. Okay, but hypocretin and hypocretin 2 are neuropeptides produced in lateral thalamus that function to promote wakefulness, and they stop REM sleep related phenomena. Most patients who have narcolepsy with cataplexy demonstrate undetectable levels of hypocretin in their CSF, which is why they sleep. Okay, so this is what you guys know. This hypocretin and hypocretin 2 are neuropeptides that are produced in the lateral thalamus. Okay, we have anterior thalamus, posterior thalamus, and they all have functions. We're gonna get into that, but lateral hypo, lateral hypo, lateral hypo, oopsies, hypo, hypothalamus. Okay, so lateral hypothalamus makes hypocretin 1 and hypocretin 2, which makes you stay awake. But somebody with narcolepsy, they don't have hypocretin 1 and hypocretin 2, which is why they sleep during the day. Due to decreased orexin or hypocretin produced in the lateral hypothalamus and dysregulated sleep wake cycle. See this? Narcolepsy. Excessive daytime sleepiness despite being well rested. The recurrent episodes are rapid onset, overwhelming sleepiness more than three times a week for the last 3 months due to decreased orexin. Remember orexin? Okay. Production in the lateral hypothalamus and dysregulated sleep-wake cycle associated with the hypnagogic and hypnopompic hallucinations. Hypnagogic hallucinations is hallucinations you have right before you sleep. Hypnopompic um, is hallucinations you have just before you wake up in the morning. Nocturnal and narcoleptic sleep episodes that start with REM sleep paralysis. Okay, nocturnal and narcoleptic sleep disorders that start with REM sleep. Cataplexy, loss of all muscle tone following strong emotional stimulus such as laughter. Yeah, so basically, somebody with cataplexy, um, they laugh really hard and they just go limp So they just fall, loss of all muscle tone. Okay, so that's that's a type of narcolepsy, and then narcolepsy without cataplexy. Um, Not okay. Is just excessive daytime sleepiness. E- So narcolepsy without cataplexy demonstrate undetectable hypocretin levels in their CSF. Okay. All right. So that's that. Bipolar 2 is a hypnomanic episode with at least one major depressive episode in the past. Yeah, bipolar 2 is a hypnomanic episode with at least one major depressive episode in the past. This is different from cyclothymia because cyclothymic people experience at least 2 years of numerous periods of hypomanic and depressive symptoms. That does not meet the criteria for hypomania or major depressive disorder. Okay, hypomania lasts at least 4 days and must include at least three of the symptoms listed for mania. Four symptoms of mania if mood is only irritable, and this is still hypomania. Dysthymia has chronic depression most of the time and meets criteria for major depression continuously. Dysthymia patients never have met the criteria for hypomania or mania before. Dysthymia and cyclothymia patients must have never been symptom free for more than 2 months at a time. So out of the 12 months, if they if cyclothymic patients if cyclothymic patients didn't have mm, didn't have hypomanic symptom like manic or hypomanic symptoms, like symptoms are fast. If they didn't have it for 3 months, in like 3 months consecutively, that is not cyclothymia. You can't go for more than 2 months without these symptoms. Okay. Same with dysthymia. They can't be. They can't. Um, they have to meet all the symptoms, um, or most of the symptoms of major depressive disorder, but they can't go for more than 2 months without meeting those symptoms. Then it wouldn't be dysthymia. But yeah, so dysthymia has chronic depression most of the time. It meets criteria for major depression continuously. Dysthymia patients never have met criteria for hypomania or mania before. Cyclothymia. So, cyclothymia is a milder form of bipolar disorder, fluctuating between mild depressive and hypomanic symptoms. Okay, so it's a milder form of bipolar disorder, fluctuating between mild depressive and hypomanic symptoms. Must last more than or equal to 2 years, with symptoms present at least half the time, with any remission lasting less than or equal to 2 months. Yeah, so you can't be symptom free for more than 2 months. Okay. All right. So bipolar disorder, bipolar one is having more than one manic episode, with or without hypomanic or depressive episode, may be separated by any length of time. Okay. Well, bipolar 2 is a hypomanic. Bipolar 2 is a hypomanic and depressive episode. Yeah, bipolar 2 is a hypomanic and a depressive episode. No history of mania. Patient's mood and function usually normalize between episodes. Use of antidepressants can destabilize the mood. High suicide risk. Treatment is mood stabilizers like lithium valproic acid, carbamazepine, lamotrigine in atypical psychotics, which are second generation antipsychotics. Okay, they have less they have less side effects than the typical antipsychotics. Okay. Yeah, more than one manic episode, with or without a hypomanic or depressive episode, may be separated by any length of time. Okay. Okay. So hypomania lasts at least 4 days, and must include at least three of the symptoms listed for mania. Okay, but it's not mania. Mania is when you have a manic episode. That is mania. As soon as you have mania, and it's bipolar one. You don't need a hypomanic episode to be diagnosed for bipolar one. Okay, but you do need a hypomanic episode to be diagnosed for bipolar two. See, manic episode, 3 plus symptoms. Fourth, mood is irritable. Last 1 week. It's a medical emergency. Symptoms present most of the day, nearly every day, causing marked impairment in social occupational functioning, and necessitates hospitalization or psychotic features. Hypomanic episode, 3 plus symptoms. Fourth, the mood is irritable. Okay. So, last 4 days. It's not severe enough to cause hospitalization. Okay, so manic episode and hypomanic episode, they both need 3 symptoms of dig fast, 4 if mood is irritable, but only mania requires hospitalization. Okay. Yeah, okay, that's hypomania. I think I just realized someone I know has hypomania. Okay, let's see. Mm, 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 mm. Wrong one. Okay, so that's that. Major depressive episode. Ziggy Caps. What it is for S is sleep, increased sleep or decreased sleep. I would decrease interest in normal things that you like, that you once liked. G is guilt. You have increased guilt and worthlessness. E is energy. You have low energy. C is concentration. You find yourself not being able to concentrate on so many things. A is appetite. You can go up or down. You can eat more or less, but generally it is more that people eat, but not necessary. P is psychomotor retardation or agitation. So that's just like psychomotor retardation that just goes slower than they used to. S, suicidality, increased suicide. Okay. All right, ADHD, inattention or hyperactive impulsive symptoms more than 6 months. In inattentive symptoms, difficulty focusing, uh, distractible, does not listen or follow instructions, disorganized, forgetful, loses, misplaces objects, hyperactive symptoms, fidgety, unable to sit still, hyper talkative, interrupts, blurts out answers, must present in at least 2 settings, and symptoms must present before age 12. Before age 12. So all this must present in two settings. So if the child is not like this at home, but they are like this at school, this is not ADHD. That's a disruptive kid. But if the kid is the same way at home and at school, you have to consider ADHD. Um, difficulty focusing, distractible, does not listen or follow instruction, disorganized, forgetful, misplaces objects, hyperactive symptoms, fidgety, unable to sit still, hypertalkative, interrupts, blurts out answers, must present in at least 2 settings, and symptoms must present before age 12. Okay, so that's ADHD. The treatment is what? The treatment is methylphenidate. Okay, ADHD. Oh no, wrong one. Casual, just go there, turn off. Okay. Okay. Oh, sorry. ADHD. Where is it? Come on, go, go, go. Of course, it decides to freeze on me right now. I wonder if I can. Okay. I'm gonna cut the video now and then we'll come back, okay?